Hi, I'm Jeff Ramson, CEO of PCG Advisory. We're a full-service investor relations firm specializing in emerging growth companies and blockchain projects. Today we have the pleasure of meeting with Dr. Vish Verma, founder and president of Mint Health. Mint Health is a decentralized patient engagement platform. Vish, great to have you today. Thank you very much for joining us. So I was hoping maybe you tell us a bit about Mint Health.
Yes, absolutely. So Mint Health, as you mentioned, is a project leveraging blockchain to solve the hardest problem in healthcare, which is trying to drive down the spiraling costs. Today, we're going from $3 trillion to $5 trillion spend annually in the United States, 20% of GDP, some of the highest expenditure in the globe, and all of that is driven by patients with multiple chronic conditions, which when you look underneath the surface, it's due to unhealthy behaviors that lead to hypertension, diabetes, obesity, and these things are all preventable. And the overall goal and mission of Mint Health is to drive healthful behaviors by creating a new framework, incentive models, patient engagement.
Right, so it's an ecosystem amongst patients, physicians, and payers.
Correct.
Right.
And putting patients at the center, putting them in charge of their healthcare, providing transparency on their data, being able to engage them routinely outside of a hospital or clinic visit.
And this is built on the blockchain. So what's the role of blockchain in Mint Health?
So there's two important roles. One is for data liquidity. Blockchain provides a transparent, global, immutable, and auditable HIPAA log. Right. So we have a permissioning framework where we can easily allow patients to get access and have them control their data and give other providers in the ecosystem access to their data, and it's all transparent, all secure. And then the other big role that blockchain plays is giving us the ability to create a currency that's programmable for healthcare. Right. And that's our vitamin token. And that really, it drives the incentive models where patients can earn these tokens for doing healthy behaviors and then redeem them for various things, whether discounts on their copay, using at the pharmacy, other healthful goods.
How does it work for physicians related to the Mint tokens?
So the physicians get a platform to be able to engage patients outside of the office visit. It's really about providing easy ways to scale the engagement that a single provider could do. And then also even providing incentives for providers to keep their population of patients healthy.
Right. Okay, and last, payers? How does this affect them?
They're at risk. They're the ones where all this increased healthcare expenditure is hitting the payers, the self-insured companies the hardest. So for them, if what we're showing is there's clear ROI, but providing these token incentives to drive healthful behavior, where ultimately they reduce their costs and the expenditure doesn't go from 3 to 5 trillion. We can curb that. Instead, maybe it goes 3 to 4, and the overall system saves $1 trillion.
Right, which is huge.
Which is huge.
So, so I understand the vitamin token. That's a currency within the system, and now you're also doing a security token offering to raise capital to build this out.
Yes. So we're doing a unique dual token structure. The Mint Health security token just represents normal equity in the company. And what we've done is actually link the two tokens where there's a dividend paid. And this is another area where blockchain is really a great use case for, is when a vitamin token is sold, 10% of those proceeds go to Mint Health security token holders.
That's one of the things I don't know if everyone quite understands, the programmable nature of these tokens, so that the revenue or the dividend is actually automatically transferred.
Correct. And these tokens, the security token, will trade on some of the security token exchanges of the future. And really, same thing, another area that's being disrupted by blockchain, eliminating some of the intermediaries like transfer agents for instant settlement, and then also for automation, the smart contracts to control voting and dividend payments. So we're pretty excited to innovate on that end as well.
Yeah, no, you're a pioneer in the space. It's great. It really is. Vish, thank you again. That was really great, very informative. So if anyone wants more information, they would go to minthealth.io.
Yes, thanks for having me today. Sure. We have a ton of information on our website, including our white paper, and then anyone can reach out through us to our info@minthealth.io email as well.